Welcome. It's wonderful to see everyone here. For those of you who don't know me, I'm Carol Rogers, and I have the distinct pleasure of being the Dean of the Faculty of Health Sciences. And I'm really excited today to welcome all of our many honored and esteemed guests. Those of you who are here, and literally from around the world, we have a number of people who are virtually with us today, and it's very, very exciting that we can be together to do this formal launch. As we like to do, and is very important to us at Ontario Tech, we'd like to acknowledge the lands that we are on so that we can celebrate today in a very good way. And so I'd like to call upon Astrid D'Souza, who is going to do our land acknowledgement, please. Astrid's a PhD student in our health sciences program.
Ontario Tech University is proud to acknowledge the lands and people of the Mississaugas of Scugog Island First Nation. We are thankful to be welcomed on these lands in friendship. The lands we are situated on are covered under the Williams Treaties and the traditional territory of the Mississaugas, a branch of the Greater Anishinaabe Nation, including Algonquin, Ojibwe, Odawa, and Potawatomi. These lands remain home to a number of Indigenous nations and people. We acknowledge this land out of respect for the Indigenous nations who have cared for Turtle Island, also called North America, from before the arrival of settler peoples until this day. Most importantly, we remember the history of these lands has been tainted by poor treatment and a lack of friendship with the First Nations who call them home. This history is something we are all affected by, as we are all treaty people in Canada. We all have a shared history to reflect on, and each of us is affected by this history in different ways. Our past defines our present, but if we move forward as friends and allies, then it does not have to define our future. And I invite everyone to take some time to reflect on the lands where you hail from or are situated today as we move forward in a positive way on our journey of reconciliation.
Thank you, Astrid. I'm very privileged now to invite Knowledge Keeper Kathy McLeod Beaver, who is the Aboriginal Navigator for the Durham Regional Cancer Centre and the Central East Regional Cancer Program, to come forward. She is going to offer a smudge and a song to launch our centre in a good way. I have a gift of tobacco for you as well.
Bonjour, Samakwe Indigenous Kaz, Makwa Dodem, Alderville First Nation Dunjaba. It's a great honor to be here with you today as we celebrate this new relationship. And the tobacco that my friend handed me is, they say it is a medicine, it is a sacred medicine. I'm not referring to the commercial tobacco, but the tobacco that grows out there, Sama, we call it in the language. And the teaching behind that medicine is it's that medicine that goes first before everything else. So as we come together and form this new partnership, this new relationship together, we offer this medicine up to help us, guide us in that pathway forward. And I lit the smudge because that medicine, I'm burning sage today, and it's a medicine that helps us. It helps bring clarity, and it helps bring peace of mind. It also is a cleanser, and it takes care of those things that we might carry that don't belong to us, that are not ours to carry. So, it's always good to start a gathering in that way to clean us off and give us what we need to walk this journey. So I say chimiguach to the spirit of the medicine that has been offered. And I always like when I'm offering to do an opening, when I'm asked to do an opening at gatherings like this, it's always a huge honor because we know that our ancestors who walked this journey before us left behind amazing medicine. And so that's what I'm offering today, is medicine in a way of song, smudge, and good words. So I'm asking my buddy to come up and help me here. I've asked her, I put her on the spot. I like doing that. But that shaker, when we sound the shaker, it is said that the spirit world stands up. They know that somebody needs help. So that's why we're offering this. And the drum is the heartbeat of our mother. So I was lucky enough, everything that I'm talking about comes from the Creator. All these teachings, they come through people, through ancestors, through loved ones. But this drum represents the heartbeat of Mother Earth. So that is that first sound that we heard when we were being born. So the song that I'm going to sing is a song that came to me before the birth of my first granddaughter, Holly. And it came to me one morning. I was humming it and singing it, and then the words came later when I found out my daughter was expecting my first grandchild. So I was so proud and happy. And this song talks about, I thought it was an appropriate song to offer here because we're coming together. That life that comes from the east direction, that new life, that grandfather sun that comes up in the east, reminds us we've been given another day, and brings us that light and that warmth for life to continue as we know it. So that's what we're singing about today, is that life that comes from the east. Nikanagana means we're sending that out into the universe, that song. So I laugh when I sing sometimes because we've been taught that we sing these songs 4 times through or 8 times through, numbers of 4, honoring those 4 directions of the universe. And but my voice goes higher every time, and I'm glad I only do 4 because I'd lose my breath or I'd lose my voice. So Chimigwach, and thank you for allowing me to be here too. Miigwech.
Thank you very much. That was beautiful and a wonderful start to our day. It's now my pleasure to invite our President and Vice Chancellor, Dr. Stephen Murphy, to the podium to provide remarks, please.
Good morning, everyone. How are we doing? What a great day. What a wonderful Friday. A great day to celebrate. Thank you for joining us. I want to thank Kathy. Thank you for getting us off to a great start. I want to thank Dean Rogers for all the work that I think she's gone around the corner that she's done an amazing amount of work. Minister Holland, thank you for being such a champion on this file. Dr. Dutin, thank you for traveling all the way around the world to represent the World Health Organization from Geneva. Hats off to you, sir. And then I come to Dr. Cote. Congratulations, Dr. Cote, to you and your team. What a big effort. Your hard work to have our Institute for Disability and Rehabilitation designated by the World Health Organization as a collaborating center for rehabilitation and musculoskeletal health. Congratulations. Let's give that a big round of applause. It's so beautiful to see that, because at Ontario Tech, what we really try to do every day is we try to uplift humanity, enhance lives, and better communities. And you're doing that in every way in this center. We're excited to watch Dr. Cote and his team. He'll be the first one to say, it's my team. And that is so important, because he's educating the next generation in this field as well, which is incredibly important when we think about explaining to societies why universities are important, and the highly qualified personnel, we call it HQP, that's why I trip over it, highly qualified personnel that he trains are so important to our whole society. It's a great example of Ontario Tech at its finest. It's tech with a conscience. It's impacting people's lives in a tangible way. It's training researchers and practitioners. It has international stature with the WHO, and it's groundbreaking research. So congratulations on this. I want to thank you, Dr. Cote. We're so excited for this, and I'm just going to watch what you do with this, because if there's one person in this university you don't want to place a bet against, it's Dr. Cote. He will always exceed expectations, so no pressure. But no, in all truth, it's going to be a phenomenal addition to what you're already doing. I now have the great pleasure of introducing our Minister of Health, Minister Mark Holland, who's the Ajax MPP, so we're doubly lucky to have him in our region. Minister Holland is no stranger to health and well-being of Canadians, having been the longtime advocate for healthcare through his work as an MP and his time at Heart and Stroke Foundation, and now, of course, as the Minister of Health for our country. Thank you for your support, Mr. Holland. He is a guy that rolls up his sleeves. Our minister really believes in the university. He's passionate about the Durham region. And on this file, every time we went to him, he made things happen. So without further ado, Mr. Holland, over to you. Thank you very much.
Merci beaucoup, Président Murphy. C'est un grand plaisir d'être ici avec vous pour un jour vraiment important, je pense. C'est dans la transformation de notre système de santé. C'est absolument essentiel. Les partnerships, pas juste avec l'université, mais aussi avec l'Organisation mondiale, c'est vraiment important. So just to say first, President Murphy, always fantastic to be here. I get to brag as I'm around the country about all of the incredible things that Ontario Tech is doing, and you just make us so proud, and such an essential part of what's happening in health. And let me turn to Dr. Cote, who's a force of nature, who is absolutely the reason that we're here today and the reason this is happening. And it's incredible, because this isn't just going to change lives in Canada, but it's really going to change lives around the world. And I'm so deeply excited for that. As a global hub, the Institute for Disability and Rehabilitation Research is going to continue to drive Canadian leadership in health research excellence. You know, this is the first collaboration center in Canada with a specific mandate to assist the World Health Organization in the global response to address musculoskeletal conditions by building capacity and strengthening data. And I think when we think about how lives are affected by musculoskeletal conditions, this is huge stuff. You know, and it's not just important as a matter of immediate social justice for people who are in pain, to alleviate that pain so that they can live their lives, but we know what happens when we don't. On that journey, when somebody is in pain and they have a reduced mobility, that their condition deteriorates and ends up costing our system an enormous amount of money. And one of the things that I think we need to acknowledge and this is something you can be on the left, you can be on the right, you can be any political persuasion you want. The transformation that must occur in our health system from an illness-based system to a prevention-based system is absolutely essential. And we absolutely have the power to do it. I had such a heartening conversation this morning with Dr. Jane Philpott, who is heading up primary care reform now in Ontario, talking about our aligned objectives. I was just in Quebec yesterday having a conversation with the government of Quebec about their transformation, and we're all talking the same language. When we're talking this meta-narrative of the transformation that is absolutely possible in our health system, it is so deeply exciting. And the partnership that we have with Ontario Tech, with universities across the country, with researchers. And let me talk about research for a moment, because I try to get people emotionally connected and excited about research. And that isn't always easy, right? Because it sounds heavy and technical, but the reality is research is absolutely the key to health transformation. And I was so proud in 2024 of our response to the Bouchard report, the dollars that were put forward, the commitment that's made to research, the commitment to transforming our agencies. And you know, if I just look in the very specific area of musculoskeletal health and rehabilitation research, CIHR just during the last 5 years alone has put $781 million towards that cause. That is huge. So we are with you in that, and we want to connect people emotionally to the power research has to transform. And maybe I will end on this point, which is we have a huge advantage in Canada, and we forget about it. You know, when we're talking about our GDP, of course that is deeply important, and we want to see the economic success of this country. But surely one of the things that we must be measured against at the same time is the number of years that we live in good health, free of disease and illness. Canada can be the greatest country in the world in which to age, and we already have an advantage. You know that Canada is 1 year longer not living in disease and illness in what we call health span than both France and Italy. We're 2 years longer than the United Kingdom. We are 6 years longer than the United States. We need to think about those last 10 years of life. We need to make them full of joy, movement, opportunity to be with family. And I'll tell you, that transformation, it is absolutely people like Dr. Cote who are leading the way with their passion and their drive and their commitment to see that transformation occur. It fills me with such energy and such excitement for the future of this country. I can't wait to see what you do. It's yet another example, President Murphy, of just the incredible innovation and success of this incredible university. And with that, I really thank you. It's a privilege to be with you here today for this incredible, exciting announcement. Merci beaucoup.
Thank you very much, Minister Holland. So one of the wonderful things as Dean is that you get to work with some amazingly talented people with some great big vision ideas, and then getting to witness those ideas, like seeds, fully germinate, take flight, and flourish, or in essence, become a reality. When I first arrived at Ontario Tech about 4.5 years ago, there was no such thing as an institute. Yeah, there was a center. But, you know, and then there was this center director who I actually met in a little square. I think we were 4 months into the pandemic. And he kept talking. And I have to say it was with contagious exuberance about all the great things that were happening in this center and how this center really needed to become an institute. And the reason for that was so that we could harness the strength of our partners, particular CMCC, who's been such a dedicated partner to us for so many years, and of course many others, both in our own community and, as we see today, around the world. And in that way, it could really achieve its potential. So today is truly an amazing day. For in what seems like the blink of an eye, not only did that center become an institute, but as today clearly demonstrates, it has taken the dream to the reality and become a leader in rehabilitation research. It is my distinct pleasure to now call upon Dr. Pierre Cote, the Hahn Kelly Family Chair in Disability and Rehabilitation Research, Director of the Institute for Disability and Rehabilitation Research, and now, of course, the Director of the WHO Collaborating Center for Rehabilitation and Musculoskeletal Health.
Thank you very much, Monsieur le Ministre, President Murphy, Dean Rogers, dear guest, knowledge keeper, Beaver McLeod, friends, it's a great pleasure to see you here. And I welcome you to the World Health Organization Collaborating Center for Rehabilitation and Musculoskeletal Health. And I must admit, it feels so good to finally say these words aloud. Thank you. It feels good not only because I'm extremely proud of this achievement, but because our work will contribute to improving the health and functioning of Canadians and people all over the world. Therefore, it's no accident that the inauguration of our center is taking place in Shawangagay Winning Hall, a beautiful place that was named by Elder Dorothy Taylor, who actually is such an important member of our institute, to indicate that we are now in a place of kindness. Today, it is estimated that more than 9 million Canadians with musculoskeletal conditions such as back pain or osteoarthritis could benefit from rehabilitation. Globally, this number translates to 1.5 billion people. However, accessing rehabilitation for musculoskeletal conditions remain challenging for most, especially for underserved populations. MSK conditions also impact the economic health of our societies. In Canada, it's estimated that by 2031, the productivity loss associated with osteoarthritis will be about $17.5 billion a year. In the United States in 2016, the estimated direct healthcare costs related to musculoskeletal conditions were $381 billion, exceeding the costs related to diabetes, cardiovascular disease, mental disorders, and cancer. So when we think of the aging of our population, the shortage or absence of a competent rehabilitation workforce, in particular in the primary healthcare sector, and the need to deliver effective interventions, we recognize that there is much work ahead, and it's very humbling to say this, and this is work that we must lead with kindness. My journey toward establishing a WHO collaborating center started in 2017 when I attended the first Rehabilitation 2030 meeting in Geneva and met Dr. Dutin. The discussions about unmet rehabilitation needs were unsettling. In many parts of the world, including remote regions in Canada, it is simply not possible to consult a physician, a physiotherapist, or a chiropractor if your life is impacted by musculoskeletal pain or disability. While some may see some insurmountable challenges with improving access to rehabilitation, I see opportunities. I'm very excited about this. For example, the development of new virtual rehabilitation technologies and ethical AI-based care, rehab care, offer promising avenues to reducing the accessibility gap that we're witnessing right now. So I'm very pleased today to announce that we will be able to start exploring the development of new rehabilitation technologies thanks to a major investment from Mr. Jason Rinaldi for the creation of a rehabilitation chair in AI and rehabilitation at our institute. So I'm thrilled. I'm extremely thrilled about the next 4 years. I think we will conduct research, develop education and training activities with the WHO, and provide technical advice to Dr. Dutins and his team at the WHO to support the global response to musculoskeletal condition and strengthen research in rehabilitation science globally. So as President Murphy said initially, this would, everybody in this room, you can look around and you can thank yourself for what we've achieved today because you've all contributed to this monumental achievement. So I want to take a moment to acknowledge the dedication and hard work of everyone involved in the development and the designation of the WHO Collaborating Center. I'm extremely grateful to my colleagues and graduate students at the Institute for Disability and Rehabilitation Research. And I also want to thank Dean Rogers, President Murphy, Vice President Jacobs, Provost Livingston, who I believe is online, and CMCC President Christine Brederick-Baus for your steadfast support of our mission to make evidence-based rehabilitation accessible to all. Finally, our work at the WHO's Collaborating Center would not be possible without the financial support from outstanding people from within the Durham region. And I'm thanking particularly the Han Kelly Family Foundation for providing me with a research chair that is allowing us to do this work, and also to the Canadian Chiropractic Association for providing significant support to establish the center. Thank you. So it's now my great pleasure to pass the podium to Dr. Anthony Dutin. Dr. Dutin is the technical lead for rehabilitation at the WHO headquarters in Geneva. In this role, he coordinates WHO's work to strengthen rehabilitation in health system, including the Rehabilitation 2030 initiative. Anthony is a physiotherapist from the UK who holds a doctorate in public health from the London School of Hygiene and Tropical Medicine. Anthony, the floor is yours, and thank you very much for working with us over the past 4 years to establish the center. Thank you.
Merci beaucoup pour l'invitation. C'est un grand plaisir d'être ici aujourd'hui. Rehabilitation is important. Réadaptation, c'est important. It gives life to those whose life has been saved. It puts life into the years when we add years into our lives. Rehabilitation is normal. Réadaptation est normal. We all are going to require the services of a rehabilitation professional at some point in our lives. 2.6 billion people around the world today have a condition for which rehabilitation can benefit, and as we've just heard from Pierre, 1.5 billion people of those have a musculoskeletal condition, by far the highest number and proportion of rehabilitation need. Rehabilitation is effective. Réadaptation, c'est effective. It improves health outcomes for the individual. It improves independence, functioning, and reduces burdens for caregivers. And it's not just effective for individuals, it improves the efficiency of the system as well. And finally, and I've just added my notes to this, rehabilitation is prevention. Réadaptation, c'est la prévention. It is an investment into safeguarding our health and well-being into the future. But unfortunately, rehabilitation is also misunderstood, deprioritized, and lacking in many parts of the world. It's an absolute pleasure to be here today in person for this really great launch of the IDRR becoming a collaborating center. And I just want to take a moment to say, what does that mean? Well, what does a collaborating center mean? It means that the work of Pierre and the department and the institute are now supporting the WHO on its mission. And in this case, that is 2 missions. The first, Rehabilitation 2030, which was launched in 2017 as a call to action for strengthening rehabilitation as part of the health system across the globe. And we've since then launched 10 tools and products and initiatives supporting countries, and we have a footprint of over 71 countries around the world that are now benefiting from the work being done. And just last year, we've now started to do more specific work on musculoskeletal health. We've had 4 webinars, including one this week. And I want to reinforce that the work on musculoskeletal health is not just about rehabilitation. In fact, rehabilitation is what we want to try to prevent people from needing if we invest in promotion, prevention, treatment. But we want to also make sure rehabilitation is available for those who require rehabilitation. The extraordinary work of Pierre and the team have been vital for a while and have been on our radar for quite a while, and we've had several collaborations, as you've heard, successfully. And now Ontario joins a really special family of 10 collaborating centres around the world, from Asia, Europe, and in the Americas, to join the family of collaborating centres on rehabilitation, but is the first in the world to have a specific designation on musculoskeletal health. The first in the world to have musculoskeletal health. I want to thank everybody involved for making this a reality. Of course, Pierre, but also Melissa and Poonam, Silvano, and then today, hearing from Astrid, Keeper McLeod-Beaver, Dean Rogers, and President Murphy. I know that the work behind the scenes to pull this event together, but over many years to get to where we are today, has been essential, and I thank you all for that. And finally, to Minister Holland, really want to thank you for taking time in your really busy schedule to come and join us today. And I know from Pierre that you've been along this journey all the way, and I want to really thank you for your support and involvement for this work. And for the Government of Canada and all that the Canadian government is doing for rehabilitation, you're an inspiration to see. We learn a lot from what's coming out of Canada, and I look forward to continuing collaboration. Thank you.
Thank you, Dr. Dutine. Very exciting. This now brings our formal proceedings to a close. However, I would be remiss, I would really like to extend my thanks and gratitude to our communications and media team, and in particular government relations, who have really helped us make this such a wonderful event today. And of course to our honored guests who have joined us, and our many partners here and around the world who have taken time to be with us. Thank you. It's been a wonderful day of recognition and celebration, and we are most grateful for all of your participation and support. Pierre, it's now up to you. Thank you, everyone.